The aim of the new NHS Involvement Centre is to place patients at the heart of delivering new and creative health services. It'll be based here at Warwick University's Science Park. For the past 18 months, a consortium led by the university has been developing plans to improve the relationship between patients and health professionals.
The aims for the National Centre for Involvement are about supporting and develop NHS staff and organisations to do patient and public involvement better, to help them think differently about their relationship with patients and the public, and to create a more responsive system and service.
The whole idea of patient and public involvement is nothing new, so how will this centre be different?
Well, certainly since 2001 and the new legislation that came into force then, a lot of the work has been focused on helping users to be more involved, giving them training to sit on boards, to be more active and proactive in bringing the issues that are important to them forward. Our centre is very different. We're focused on helping NHS staff and organisations think what they should do to involve users, and more importantly, how they act and make an impact with the information they gather from users, to make a difference, to make a change to what they do based on what users are telling them.
Rachel Hawley is the Director of Learning and Support. She hopes to be able to protect the needs of the public and NHS staff. She's also keen to forge close links between the centre and the university.
The key to involvement is developing the learning capacity of everybody to recognise and realise the potential for involvement. The challenge for us is to find practical and creative ways of developing the capacity of everybody through learning and development opportunities, both with informal learning and also in everyday work capacity.
The NHS Involvement Centre is keen to not only listen to the views of patients, but incorporate them into the future planning and delivery of services. It's also about boosting confidence in the NHS at a time when many feel a deep sense of mistrust in cuts to services.
I think that we're always concerned in any kind of cash-limited system. The NHS is premised on providing care free at the point of delivery, independent of need for everybody. It's a universal system, and that means resources are always going to be spread. Funding for the service waxes and wanes. What we want to ensure is that where the money is spent is based, at least in part, on the priorities that are set by local people, that they feel they have a say in shaping the service rather than it always is based on decisions made elsewhere on their behalf.
And why was Warwick University chosen as the site?
Together we came forward and shared a vision about what we felt was best, and we were lucky enough to be shortlisted. That shortlisted involved a range of different organisations and universities from across the country, and again we were lucky enough to be chosen, and we feel that's because of the different kinds of experience and expertise that the consortium members bring. It's great to have the opportunity to move the evidence from a bookshelf, from a report that you've filed, to actually trying to make a difference, to actually helping people think about what it means in practice, the evidence we've collected. And certainly colleagues in the medical school, in the Institute of Health, have all generated important information that helps provide a context for our work and also helps ensure that we have colleagues we can turn to for advice and support both within the university and nationally.